A very warm welcome to all present. Over the last 2 years, we have experienced unforeseen circumstances, from the very beginning of the global pandemic to its recent resurgence in the country. But as concerning as the second wave was, the third wave is anticipated to pose an even greater challenge. So, what better way to prepare for the upcoming wave than to have all our concerns, questions, and curiosities alleviated by the renowned and respected Dr. Randeep Guleria as he talks about preparing children for the third wave of the pandemic. May I request the audience to please keep their microphones and videos off during the session? If you have any questions, please type them in the chat box.
Now, allow me to introduce our esteemed guest speaker, Dr. Randeep Guleria, Director of AIIMS, New Delhi. Dr. Guleria is the first AM in pulmonary medicine in the country, and the Department of Pulmonary Medicine and Sleep Disorders has been created under his leadership in 2011. His various awards and accolades in the field of medicine include the prestigious Padma Shri by the Government of India in 2015, Dr. B.C. Roy National Award in 2014, and the Doctor of the Decade Award by the Indian Medical Association. He is also a member of the National Task Force for the Government of India for COVID-19 and a member of Empowered Group 2 created by the Prime Minister's Office for Multi-Sectorial Management of COVID-19. He is a member of WHO and has been a part of scientific advisory group of experts stage, working with the group for influenza vaccination and immunization, Geneva. We are honored to have you here, sir. Please accept this virtual token of our gratitude. I would now like to invite our respected principal ma'am, Ms. Padma Srinivasan, to say a few words of welcome.
Thank you, Shivya, and welcome, sir, to this program. It is a very, very important one for us because in the news channels and everywhere, everyone is talking about the next wave being very lethal to the children. So we are concerned. The first concern, of course, is when are we going to be able to open the schools this year? And of course, the second is COVID. How are we going to deal with it? How are the children going to handle it at home? How are the parents going to handle it at home? And the black fungus, of course, which is a problem for us. And how are we going to deal with the situation in the school and with the children, especially around us all the time? So, sir, nobody better than you can explain all these things to us. So, once again, I request you, like the children, please to explain these things to us. We'll be very grateful. Thank you for accepting our invitation.
Thank you, ma'am, for your warm and welcoming words. Now, I would like to invite our Vice Principal, Dr. Renu Nair, to address.
A very good evening to everyone present here. COVID has struck us in a big way. There is a lot of information being circulated on social media, and it's hard to assess what to believe. Today, we have the pleasure of being in the company of Dr. Guleria. His insight and experience is guiding the country today. We are privileged to have him here amongst us today. Doctor, your words of wisdom are source of inspiration for many. Your experience and expertise is invaluable. I again welcome you, sir, and we hope our parents, students, and staff would gain a lot from this webinar. Thank you.
Thank you, ma'am, for your words of wisdom. The past year has brought about unprecedented changes in our lifestyles and livelihoods due to the advent of the COVID-19 disease. Before 2020, the very idea of a global lockdown was unimaginable, but now it has become part of our daily lives. The third wave of COVID-19 has led to a resurgence of the worries and questions that plagued us all at the start of the pandemic, and as a result, we have received a lot of questions from students, parents, and faculty about the same. And so, in order to assuage your doubts and worries, we at DPS Archipur have chosen a wide variety of questions that cover a wide spectrum of topics to be answered by Dr. Guleria. So without further ado, let's begin. Our first question was asked by our principal, Ms. Padma Srinivasan. So what are your biggest concerns regarding the third wave of COVID for the students and the schools?
Thank you very much for inviting me, Ms. Padma Srinivasan, Dr. Renu Nair, all the other teachers of DPS, parents, and students. I hope I'm audible to all of you to begin with.
Yes,
So,
sir.
okay. So I think COVID-19 has really changed our life in manners which we never really dreamed that would happen. And many of us really have said that COVID-19 is a pandemic which is involving mainly the elderly, the older age group in terms of morbidity, mortality, and it's not that much of a pandemic of children and adolescents because in them the disease is usually mild and they recover on their own. But that, in my mind, is not really true because COVID-19 has not only caused illness in children, although it's much milder, but it has led to what we call a lot of collateral damage. And that is because of the huge effect it's had on education, on learning, on the growth of children, and has really put up new challenges for parents, for teachers, and for everyone in society. Because in my mind, children are the backbone and the future of tomorrow. And that is why we need to really nurture them very, very well. So, what are my biggest concerns regarding the third wave of COVID 19? My biggest concerns are that we should not falter and make the same mistakes that we made after the first wave. And that is that we must understand our responsibility. And I've really reached out to students to really educate not only themselves, but their parents and everyone on the importance of having COVID appropriate behavior. The mistakes that we made after the first wave was that we felt that COVID is over, vaccination is being rolled out, and we don't need to have COVID appropriate behavior. But the virus was still around, it was mutating, it was becoming more infectious, more developing the ability to spread even more rapidly. And that actually led to this huge surge, which has caused a lot of loss of lives and a lot of misery. As a matter of fact, it has shown no mercy on families, and many, many families have actually suffered immense loss. And therefore, I think we should not really make the same mistakes. So what concerns me most from the students' point of view is that we need to be very careful in terms of making sure that whatever we've learned, we are able to propagate that to society. Students can come together and really bring people together so that we are having COVID appropriate behavior. Remember, no matter what be the virus variant, if we are able to wear masks, if we maintain physical distancing, if we wash our hands, the virus cannot spread from one person to the other, and it is a human to human transmission that happens. If we break the chain of transmission, we will have less number of cases and we will all be safe. There's a lot of concern, and I think is also going to be there. So I'm going to answer that question right now. That is this third wave going to affect more of the children and adolescents as compared to the first and second wave? Again, I don't think the data supports it. If you look at data from the first wave, if you look at data from the second wave, or we look at data across the world from the various waves that have come, none of them have actually really caused a disproportionate increase in severity of illness in children and adolescents. So for reasons that we know that could be related to children and adolescents having less number of ACE receptors in the lungs, it seems that children and adolescents will continue to have a minor or a milder illness, but they will still be infectious. They will spread the infection in the community, and therefore they need to protect themselves as much as other individuals need to do that. The challenge that I think that is there today is how do we really start our education in a manner that we have COVID also, but we don't have issues of uh, loss of learning outcomes, loss of growth of children, loss of development of children and their career, along with making sure that we don't have an environment where the infection starts spreading more rapidly. Those are the challenges that we need to work on. And that is my biggest concern, that how do we balance out these two things? Ongoing education for children, especially those who are marginalized, so that there is no gender gap, There are no dropouts. We are able to address issues of stress and mental health also because of children being coped up at home. All of this we need to look at in the coming months, along with appropriate management as far as COVID is concerned.
Thank you, sir, for your insight. Now, a second question was put forward by Ms. Dimple Menon of the Department of Biology, TPS Archipel. Ma'am?
Good evening, sir. What is the science behind the hypothesis of the third wave? You already answered the second part of the question, which was how is it predicted that children would be the most vulnerable to the third wave?
Okay, so when we look at viral infections, especially respiratory viral infections, they do tend to come in waves. What does that mean? What it means is that there can be 2 or 3 factors which drive the viral replication. One of them is, of course, the environment. And that is basically what we see in certain respiratory infections. For example, influenza, the flu that we get. Data from our country suggests that we have 2 peaks or 2 sort of waves as far as influenza is concerned. The first wave happens, or the spike happens, during the monsoon months, and the second happens during the winter months, and we have less influenza during the summer months. COVID-19 hasn't really acquired a seasonality as of now, but it will in due course of time. But what it really means is that viral infections do follow some degree of seasonality. Also, it is dependent on human behavior. So whenever the cases go up to a large extent, we become more scared, we are following appropriate behavior, we don't allow the virus to spread, and the chain of transmission is broken and the cases come down. When the cases come down to a very low level, then there is a change in human behavior. And that is what I was trying to emphasize, that we have to continue to follow COVID appropriate behavior. That change in human behavior again allows the virus to spread. And this leads to another wave. And this continues till there is good amount of immunity in the community or in society or in the population, that now, even when there is a new surge in cases, they're not able to spread because of everyone having some degree of immunity. And then from a pandemic disease, it becomes an endemic disease where you have cases, but the number becomes much less. So this is how it evolves. This is what we saw also in the 1918 and 19 pandemic, where also the influenza pandemic came in waves and then subsequently became an endemic disease.
Thank you, sir, for your insight.
Our next question comes from the parents of Sabyasachi Roy of Class 8B.
Good afternoon, Dr. Guleria. We have seen that hyperactive immune disorder in COVID-19 contributed to the severity in patients and was a major factor in the high death toll among older adults in the second wave. Are we expected to see a similar trend among children during the third wave? And if so, what are the telltale signs and how could we prevent this?
So there are 2 things in this. One is the hyperactive immune disorder, which we call a cytokine storm, or the hyper inflammation that we see in adults. That tends to happen usually in the second week of COVID infection. And once the viral viremia is coming down, the viral load is coming down, the immune system of the body becomes hyperreactive or hyperactive. And there is a sort of a self-destruct phenomena which goes into place, with your markers being very high, clotting occurring in various parts of the body, and there being a fall in oxygen saturation, for which we give high dose steroids, we give drugs like tocilizumab, and this is a treatment strategy. However, this doesn't seem to happen much more in children. Children tend to not have such a high cytokine storm. But we do see another disorder in children, which is known as multi-system inflammatory syndrome of children, which is being reported now that it happens. And this happens actually after the child has recovered from COVID, and usually happens after 3 to 4 weeks. And then there is again fever, there is an immune reaction, which is a multi-system immune reaction, which causes fever, it causes a skin rash, it causes cardiac involvement in the form of myocarditis, and there are other lesions. And for these children, once they're diagnosed, you need to give drugs like steroids and IVIG. This is now being reported. It was initially reported from the West, And cases were being reported of this multi-system inflammatory syndrome in children. It was thought to be linked to another disease which has a similar presentation known as Kawasaki's disease. This can happen, but this happens almost 3 to 4 weeks after the child has recovered from COVID-19, and pediatricians are well aware of it and are on the lookout. And we do see occasionally such cases in our setup also. But the hyperreactive immune syndrome, which occurs with COVID, doesn't seem to be that much of an issue as far as children are concerned as compared to older adults.
Thank you, sir, for your insights. Our next question comes from Ms. Ruby Bhattacharya of Department of Mathematics, DPS Arkipuram.
Good evening, sir. What are the chances of those children getting infected by the third wave who have already been infected within the last 3 months?
So I think we should understand that whether it's children or adults, whenever you get infection, and now there is a very nice paper which has come out also, which actually is very positive. Once you get natural infection, you get immunity to some extent, and you get immunity which is both what we call antibody formation, the humoral immunity, and we also get what we call a cell-mediated immunity, which is through T cells, and you have the memory T cells in your marrow, bone marrow, which remember the virus and are able to produce more antibodies when there is an exposure to the virus. So what is being now shown is that once you get infected with COVID-19, you get good amount of immunity. And some papers now are suggesting that this is long lasting because of the T memory cells in your bone marrow, which remember the signature of the virus. And whenever there is an exposure to the virus, they quickly start producing a large amount of antibodies to take care of the viral replication and don't allow the virus to really cause severe disease. So I think once, if you had COVID in the past, the children are protected, and the chances of them getting reinfection are less likely. Data from the ICMR suggests that in terms of adults also, this was only around 4% of people who got reinfection in those who had got infected in the first wave. So it's going to be very, very low.
Thank you, sir, for clearing that issue up.
The next question has been put forward by the parent of Akul Ranjan of 11J.
Good evening, sir. Many different kinds of fungal infections have been observed in the patients. What could be the possible reason behind rise in cases of black fungus? Does intake in zinc supplements increase the risk? How can it be prevented?
Thank you very much. So there are different type of fungal infections which have been reported. And unfortunately, we are going by the color black, white, yellow. I think for all of us, and especially for students, it's important to really take the name of the fungus or the fungi rather than going by the color. So the black fungus, which is actually a misnomer because black fungus is actually a different group of fungi. The taxonomy is different. A black fungus, what we are currently seeing is what is known as mucormycosis, which is a fungus which predominantly affects the sinuses, the nose, the sinuses, and the bone around the eye, the orbit, and it affects the lungs, but it can also affect other organs. The other is the white fungus, which is also being reported, which is Candida. This is another fungus which causes infection of either the oral, the throat, the tongue, the esophagus. You can have what we call oropharyngeal candidiasis. It can also sometimes cause infection in the blood, and it can also sometimes cause infection in the private parts. So this is the type of fungal infection that one can see. What is the reason behind this huge increase in mucormycosis, so-called black fungus? There are 3 or 4 reasons which are very obvious, and this was seen to some extent during the first wave also, and has also been reported during the SARS outbreak in 2002-2003. One is the virus itself. The virus itself causes a decrease in your immune system and predisposes to secondary fungal infection. Secondly, the use of steroids. If there's excessive use of steroids when they are not needed, this can also be an important cause. But the other very important cause is people who have underlying diabetes. Diabetes has been a risk factor even before COVID-19, as poorly controlled diabetes patients were having higher chance of fungal infections. So if anyone has diabetes, it's very important that they control their sugars very, very regularly and properly so that they don't have high sugars. And if you are getting the infection, then it's all the more reason to monitor your sugars and take the medication properly. Sometimes you may need to have a short course of insulin also, because the combination of poor controlled diabetes, COVID infection, and use of steroids leads to a very high chance of developing fungal infection. And it is preventable if we are able to control the sugars very well. If we give judicious, use steroids only judiciously. Steroids are very useful in COVID-19 in moderate to severe case, but are not of any use in mild disease, and low dose should be used rather than high dose. And therefore, if we take these measures, we can prevent fungal infections. Does zinc help, or does zinc at least increase the risk? There are some papers which have found a cause and effect relationship and tend to suggest that zinc supplement may be associated with high chances of infection, but I don't think there is enough data to say that zinc supplement do cause higher chance of fungal infection. Therefore, I don't think we can say that right now.
Thank you, sir. That was indeed very informative. The next question has been asked by Mr. Pankaj Singh Bish of the Department of Physics, DPS Arkipuram.
Good evening, sir. Sir, my question is, are children suffering from chronic diseases like asthma and allergies at a greater risk from third wave of COVID?
So there are certain groups of children whom we found are at a greater risk for getting more severe disease as far as COVID is concerned. So there are two parts. Are you more, do you have a higher chance of developing COVID, or do you have a higher chance of developing more severe disease? So when we say, do you have a higher chance of developing COVID, it depends on your behavior actually. If you wear your mask properly, if you maintain distancing, the chance of developing COVID is low. If you don't do that, no matter whether you are healthy or you have asthma or any other allergies, you will get COVID. The second is, what is the chance of getting more severe disease? From that point of view, we've seen even in the second wave, the children who had underlying comorbidities, and asthma and allergy was not the prominent comorbidities, but those who had, let's say, children who had what we call insulin dependent diabetes, who were on insulin, or who were obese for that matter, or who were on certain drugs which were immunosuppressants for diseases like nephrotic syndrome or chemotherapy, they had more severe COVID. Healthy children had less chances of having more severe COVID. As far as asthma and allergies are concerned, it's important that you control them, because asthma is a respiratory disease. It causes more inflammation in the lung. And therefore, if you get COVID and it also affects your lung, it can cause more breathing difficulty. Therefore, good control of asthma and allergies is also important during this time of the year. But I wouldn't say that this is the predominant comorbidity which one should worry about. Yes, asthmatics and those who have allergic rhinitis and other allergies need to be extra careful. But especially children who have diseases which cause their immunity to be low, or on drugs where their immunity is low, have to be especially safe, because they can get more severe COVID.
Thank you, sir, for your counsel.
Our next question is by Ms. Namrata Saini from DPS East of Kailash.
Good evening, sir. Vaccines are in short supply. People are not able to get their second jab in the recommended period of time. Is it okay if the duration of the window period exceeds the recommended time?
Yes, it's okay if the duration of the second jab exceeds the recommended period of time. And that is why the recommended period of time for some vaccines has actually been extended, because it seems that sometimes you may get more benefit by extending the period of time to some extent. What we've seen with, now we will have 3, but currently we have 2 vaccines. One is Covaxin and Covishield. Covaxin, the duration is 4 to 6 weeks. So if you don't take it on the 4th week, you can even take it from up to the 6th week, or you could even delay it beyond the 6 weeks. As far as Covishield is concerned, the duration now from 6 to 8 weeks has gone up to 12 weeks. And this is based on the scientific data which emerged from UK, where they had done this during December when they had this huge spike in the number of cases. and subsequent evaluation showed that if you delayed your second jab by 12 weeks, you got a better antibody response, and your immunity was much better than if you did got the second shot within 4 to 5 weeks. And that led to the group of experts which is looking into this to recommend it that you can take it even after 12 to 16 weeks. So you can delay your shot if you don't get the vaccine, or for some other reason you can't come up forward and take the vaccine. Don't worry, you will still get good amount of immunity and the vaccines will still work.
Thank you for clearing that up, sir. Our next question is by Ms. Sonal Sharma from the Department of English, DPS Vasant Vihar.
Good evening, Dr. Guleria. My question is, we have been hearing about a cocktail of antibodies being effective in the treatment of COVID patients. Could you give us a little more insight into that? Thank you.
Okay, so when you're talking of antibodies, we're talking of what we call monoclonal antibodies. So, and not antibiotics. I'm just sort of telling you there's a difference between antibiotics and antibodies. So the antibodies that we're talking of currently are like antibodies against the virus. So let me try and simplify it and then tell you what this is. So if you look at, there was a lot of discussion on giving what we call plasma, convalescent plasma for people, from people who had recovered. And although that is not in the guidelines now, the basis behind that was that this plasma also contained antibodies against COVID. And if you gave it to a person who was suffering from COVID, these antibodies would fight the virus and therefore bring down your viral load and you would recover early. Keeping that in mind and looking at it from the point of view of making this more in a concentrated manner, monoclonal antibodies or antibodies which could be made in the lab. So you took plasma from people who had recovered and you extracted the antibodies, and then you could make it synthetically in the lab. They were made by companies and they were made in a high concentration so that they would be more effective. And if we gave them early in the disease, when the virus had just entered the body and was just multiplying, you could then prevent the virus from entering the cell by neutralizing the viral virus with these antibodies, and this would help. So this was shown that these antibodies, if they're given early in the first few days of the viral infection, especially in those who have chances of having severe illness, those who are with comorbidities, the elderly, many of them would not go on to develop severe illness and would recover. This led to the use of monoclonal antibodies. These are the antibodies which even Donald Trump took when he got COVID-19 and recovered. And these are now available in our country and they are being used, but they are used only for those individuals who present early and who have a chance of going on to develop severe disease and therefore can be given these, their antibodies. They're in the injectable form. Just one dose is required, but has to be given in a hospital setting, but you don't have to be admitted for it. So this is, it will have a role. And there is data which suggests that even in the younger age group, they could be used, especially, like I said, in children who have comorbidities and have a chance of developing severe infection.
Thank you, sir. That was very helpful.
The next question has been asked by the parents of Aditya Agarwal of 12W.
Good evening, sir. My question is that doctors get a declaration form signed from family members or guardian of the patient before undertaking any operation. So why are there concerns if Pfizer wants a clarity on legal indemnity? Is that reason enough to not allow the vaccine into India?
So I totally agree with you. I think this should be easily resolved. The only issue is that this has to have a legal binding from the government, and I'm not sure what the procedures are. But what Pfizer has asked for is something that it has taken from many governments, that there has to be a legal indemnity, that Pfizer cannot be sued for any short-term or long-term side effects that may happen with the vaccine, because we don't know about the long-term side effects, and the government would protect them from any such action. And this has to be approved because this has a legal implication. But I think this should not be an issue, and I'm very hopeful that this will get resolved within a few days. The challenge that we have is that Pfizer should have enough doses to give to India. Currently, Pfizer has been booked for a large number of international countries for the vaccine and much in advance, and advance payment has also been done. But we are hopeful that Pfizer will be able to provide some vaccines to India also, and we will be able to benefit from another pool of vaccines along with Covaxin, Covishield, and Sputnik. But I don't think this clause should not be a problem and should get resolved very quickly.
Thank you, sir, for your insight. The next question has been asked by Ms. Alisha Gambhir of the Department of English, DPS East of Kailash.
Good evening, everyone. Good evening, Dr. Guleria. So my question is, a combination of different vaccines, Covaxin and Covishield, was administered to some people in UP. What could be the possible repercussions?
So you're right, and this has been a lot of concern. Let me explain in this way. Does it make a big difference? Possibly not. In an ideal situation, you should get the same shot that you got as the initial shot, which is the prime shot, and the second shot, which is the booster shot, should be the same. But there is a lot of research going on to see, can you mix and match your vaccines in terms of better efficacy? And there are studies which have looked at giving, let's say, the AstraZeneca vaccine first, and then subsequently the Pfizer vaccine. The theory behind this was that if you were to give two different vaccines from two different platforms, which ultimately form the same degree of antibodies, you may get a better response. So your prime vaccine becomes one and your booster vaccine becomes another. And there are some studies which suggest that this may happen. The first issue is that, is it safe? And that was something that one was concerned about. The data from the people who got this vaccine did not show significant side effects. And the data which has emerged from these trials, which I think is now done, which has been tried in almost 600 people, they did not find any side effects. And they said that you're combining different vaccines may be safe, but the data in terms of whether it is beneficial or causes better effect is being looked at. Some preliminary studies, some preliminary data that they have shared does suggest that it may actually be a little beneficial. This will actually be useful for us in the long run because it will give us the opportunity of being able to combine all our vaccines into one rather than saying that one can be tried and only the other. But I think we need more data, and these people who have got it by mistake should be followed up closely because they could give us more insights whether this could be tried in our country also.
Thank you, sir. That was most informative. The next question is asked by the parent of Aishwarya Bhatia of 12D.
So good evening, doctor. How elaborately is India doing genome sequencing, and how quickly will be able to identify if the virus has undergone another virulent or more contagious mutation? Thanks.
So I think this is a very important question because as we go ahead, we have to be able to be ahead of the virus. Currently, India has set up 10 labs which are doing genome sequencing, which is known as the INSAGOG, and they are more and more being added. Hopefully, this will become almost double of the number of labs which are there. The initial plan was to do at least 5% of all the samples that are being done in our country should have gene sequencing. Along with that, we must also pick up samples from areas where we see a certain rise in number of cases to see whether any new variant is developed in that area. Along with that, you have to combine it with what we call clinico-epidemiological data. You may pick up a variant, but after that, you have to find out, is this a variant of interest? That means this is a variant which you've picked up, but it doesn't do much as far as the disease is concerned. If it does something as far as the disease is concerned, then you call it a variant of concern. And then you're looking at, is this variant of concern, has it become more infectious? Is it spreading more rapidly? As we saw with the B117 from UK, that the Kent strain was causing more infection. It was spreading very rapidly. Secondly, is it more virulent? Is it causing more severe disease? Are we getting more deaths because of this? And do we need to take some action as far as that is concerned? Or thirdly, is it a virus which has developed what we call an immune escape mechanism? It is now escaping the antibodies which are formed either naturally or by the vaccine. And therefore, it is causing more reinfection, or it is decreasing the efficacy of the vaccine. So all of this is being done because this needs to be looked at not only by picking up the sequence, the picking up the variant, but studying the variant in the lab to see whether it is causing effect on the vaccine, and to see the data as to whether it's causing more cases or more severe cases. So this is being done. It's an ongoing process. But I would say that I personally would feel that we have to be aggressive in this now, because we are doing a lot of testing, but we now need to go on to more and more genome sequencing. The government is working on this because these are not easy things to perform, but I think we will have more than 20 labs in the next few weeks that will be doing genome sequencing, and I'm hopeful that we stay ahead of the virus rather than behind it.
Thank you, sir, for your comprehensive explanation. The last question is asked by the parents of Arjun Kanwar of 6th time.
Good evening, sir. I think this question would be on all parents' mind. It's been a year and a half since the onset of COVID-19. When do you think, according to you, the situation would get to normal to conduct offline classes, and how will we know that the pandemic has come to an end?
So coming to the second part first, because that's easier to answer. We will come to when the pandemic has come to an end, when there is global data and WHO will declare it. We move from what we call various stages of a pandemic to what we call then the pandemic being over and an inter-pandemic period. That is till the next pandemic. So currently it will depend on how the cases pan out, not only in our own country, but globally, because it's a global pandemic and we have to have a decrease in number of cases across the globe. This was what happened during H1N1 pandemic also in 2009, which was known as swine flu. And that also was declared a pandemic by WHO. And then they subsequently declared that the pandemic has come to an end. The second part of the first part of your question was, when will the situation get to normal to conduct offline classes? This is something which is on everyone's mind. And it's not only for schools, but it's for colleges also. And even for universities like us, because we also have undergraduate students, we have postgraduate students, we have postdoctoral, we have fellows, and a lot of training has suffered over the last 12 to 16 months. And I can understand that's happened in schools also. It is a challenging time, and there are a lot of things that have been looked at. One is looking at a hybrid model. In my mind, what we will have to do is, I think it's very important that we also work on not only online but offline classes, because it's important for overall growth of children and for the many things that they need to do in terms of development, in terms of opportunities, and being able to grow holistically. Therefore, we need to find a balance, because we know that children do get mild infection, but we know that they are equally infectious. At the same time, we don't want that they should be the source of spreading infection in the community. Therefore, we will have to look at multiple strategies. And I think one strategy is to look at the cases in that area. If the cases in that area have come down significantly, if the positivity rate is low, then in a graded manner, one can consider opening schools and having offline classes. One could have different mechanisms that have been tried across the world. Some countries have tried half the school coming on one day and half on the other day, so that there is less crowding and students can sit at a distance, and there is some degree of physical distancing. Others have tried different hybrid models and regular temperature checking. Some universities in the US do regular twice a week rapid antigen testing of the students to pick up any child who has got COVID infection early and isolate them as quickly as possible. So we will have to look at our own solutions. But I am hopeful that if we are able to have a decrease in the number of cases now, and if the vaccine rollout starts very aggressively in the next 2-3 months, hopefully then, let's say in the third quarter of this year, we should start looking at some degree of offline classes.
Thank you, sir, for your insight.
And now we'll take some questions posted by our audience members in the chat box. Our first question comes from the parents of Mohammad Arman Firdausi of class 7th F. Why is the present vaccine not suitable for children? How soon the vaccine for children will be made available in India?
So the vaccine trials which are done, the first time when you do vaccine trials, you don't do it in children, you do it in healthy adults, and you also don't do it in people with comorbidities or other things like pregnant women, lactating mothers. And that is why in the first regulatory approval, vaccines are approved basically for adults and those with comorbidities. Subsequently, even in the trials are done in elderly group and to see that they are safe and effective. Now we have had trials which have been done. Pfizer's trial and Moderna's trial has already been done and shown to be useful in children. Remember, children, we cannot say that children are little adults and we can give the same vaccine to children as we're giving to adults without really worrying about side effects or about the dose. So we have to be careful that vaccines are safe in children, and we have to be clear as to what is the ideal dose to give to children, especially considering those in the lower age group. And that is why some degree of trials are required. These trials have been done for the Pfizer and the Moderna vaccine. Bharat Biotech for Covaxin has also started its trial for vaccine for children, and that those are ongoing in India. And one is hopeful that by September we will have the data out and the vaccines will be available for children by September. One is also looking at data from other vaccines like the AstraZeneca Covishield. And I'm hopeful that in the coming months, we will have vaccines available for children also. It is important that if we want to really decrease our number of cases, we vaccinate children also as early as possible.
Thank you, sir, for clearing that issue up. Our next question comes from our principal, Ms. Padma Srinivasan. Does black fungus enter through body openings only, or can it spread through physical contact as well?
So black fungus is not a contagious disease. So it does not really spread through close contact. And if you're sitting with someone who may have black fungus, you will not get it. So it's important to remember that unlike COVID, it is not contagious. It cannot spread from one person to the other. It is usually present in the soil and in the environment. And it may sometimes be even present in someone, healthy people's nose and throat for some time, and then the immune system sort of takes care of it. If your immune system is low or you have an underlying disease process which allows the fungus to enter your body, then it starts sort of multiplying and getting into the body. Otherwise, if your immune system is strong, if your sugars are well controlled, you're not on that much of steroids, you are not on immunosuppressant drugs, the fungus does not cause significant degree of invasive infection.
Thank you, sir, for enlightening us on that issue. Our next question comes from the parents of Aryan of class 9th L. What are the long-term effects on the lungs in cases which suffered from severe pneumonia?
So this is a cause of concern initially, what we would call is post-COVID sequelae. And there are a large number of people who have patches in their X-ray on a CT scan, and one is worried, will this be long-lasting or not? What we've seen is that almost 95 to 98% of people who have patches on their lungs, by the 12th week, 8 to 12 weeks, it actually really goes away. In majority of time, it just goes away and there is really no shadow left behind. In some, there is a few scars left behind, but they don't cause much problem. In a small number of people who have extensive damage of the lungs and the lungs are not able to recover, they have what we call post-COVID lung fibrosis. And this usually lasts for even more than 12 weeks. Some of these patients have had to be on oxygen for a long time and go home also on long-term oxygen therapy. And we then advise them a lot of breathing exercise, what we call pulmonary rehabilitation. And some have very severe disease and have even had to go on to have surgery like lung transplant.
Thank you, sir, for the insightful advice. Our next question comes from Ms. Reema Khosla from the Bio Department of DPS Arkipuram. What is the maximum severity or deaths observed in breakthrough cases?
Maximum severity or death in breakthrough cases is, I can't give you a number, but I would say that in cases who have had breakthrough infection, the chances of infection are usually milder as compared to those who have not had it. And the mortality also is relatively less. But it's not that it cannot happen. There are people who have had breakthrough infections and have had severe disease also. And especially if you're looking at breakthrough infections occurring after the first shot of the vaccine rather than after the 2 shots of the vaccine.
Thank you, sir, for guiding us through that issue. Our next question comes from Sushma Sardana, Bio Department, DPSR Kipuram. Currently, we have prescribed 2 doses of vaccine. Do you think in times to come, booster doses would be required, perhaps for novel variants which arise?
Yes, that is quite likely. And we may have to look at a booster dose in the near future, which will be both from the point of view of the emerging variants and also looking at if our immunity has come down and whether we need to enhance that. A lot of companies are now working on looking at the booster dose, and possibly by next year we will be looking at a booster dose. We do give a regular booster dose for influenza every year. We give an annual influenza shot because the influenza virus also mutates regularly, and that is why the vaccine that has been taken the year before becomes less effective. It's possible that we may reach a situation where we may have to give a regular vaccination for COVID-19. Whether it has to be done every year or every few years is something that is not clear right now, but we will need to have a booster dose for at least for the time being.
Thank you, sir. Our next question is from Shrishti Datar of 6th A. Since most healthcare workers got their second dose of Covishield after 4 weeks, and now that the guidelines have changed, could there be a possibility of a booster dose to enhance the vaccine's efficacy?
This is a concern which even the healthcare workers had, that now that we are saying that you take it after 12 weeks, is their efficacy less? So to some extent, they have a point, because at that point in time, whatever data we had suggested that 4 weeks should be ideal because of the studies which were done at that point in time. So one has to observe and see how they behave, and in case their immunity wanes, then like we said, they may need to take a booster shot, which may have to happen earlier rather than later.
Thank you, sir, for the advice. So the next question is by the parent of Arush of 9N. Is mucormycosis deadlier than the coronavirus?
So mucormycosis is, well, in terms of causing more severe illness, yes. Coronavirus, of course, has a spectrum of illness. You can have mild asymptomatic illness and you can have severe illness, which can cause you to have very be in a very bad situation requiring ventilatory support. Mucormycosis is more difficult to treat because for treatment of mucormycosis, you have to take antifungal for weeks, and also surgery is required. You have to remove the dead tissue and the fungus. Otherwise, it becomes difficult to cure and it can lead to mortality. If picked up early, it is easy to treat, but you need to take treatment for 4 to 6 weeks. If missed and it spreads into the brain or causes deep invasion, then a lot of aggressive surgery is required. And there are people who had part of their nose removed or the teeth removed or the part of the jaw removed because of the fungus having invaded into the bones there. And that is why in terms of morbidity, it is much more worrisome as compared to COVID-19.
Sir, the next question is from the parent of Love Anand of 9O. Does our immunity decreases after some time after COVID vaccine?
So it does not. There has been a lot of concern that some people have come and told me that, if I take the vaccine for a few days, my immunity will come down and therefore I should not go out. I should stay indoors. And after the vaccine, I have a higher chance of getting COVID infection if I am exposed to someone outside. But there is no data to support this. The data does not support that after vaccination, your immunity comes down and you can get COVID after vaccination. There have been people who have got COVID after taking the vaccine, but that seems to be because of the fact that sometimes the place that you go to take the vaccine, and if you're not following COVID appropriate behavior, then that can become a hotspot and you could get the infection in that area from someone because of the fact that you may be crowding together, you may be sitting together to get the vaccine, or after the vaccine, the half an hour that you have to wait, you may not be maintaining physical distancing, or your mask may be down, and that may cause the infection to happen.
Thank you, sir. That was informative indeed. The next question is from Adarsh Jha of 7th E. So the RT-PCR test failed in the second wave of COVID, and would it not work in the third wave? So then what should we do?
So first of all, I don't think the RT-PCR test failed. As a matter of fact, there was a lot of concern because of one gene which was mutated, and the S gene which was mutated in the variant. But a lot of studies done not only by people abroad but even by the ICMR showed that most tests, RT-PCR tests, look for two genes and they don't look for the S gene, and therefore the RT-PCR is a good test. But it's important to remember two or three things. One is every test has what we call a sensitivity and a specificity. The RT-PCR test is very specific. If it is positive, it is definitely positive unless there has been a lab contamination. But its sensitivity is around the tune of around 80%. That means you may have 20% of people who may have COVID and may have been missed because the viral load was not that high and the test did not pick them up. Therefore, you cannot say that this is a test which has 100% sensitivity and specificity. And therefore, like all tests, it has some degree of limitations. And that is why either you have to repeat it if it is becoming negative and the clinical profile is very suggestive, or you have to go by what we call a clinical radiological profile, that if in a pandemic situation, if the clinical features and the radiological features classically fit into COVID-19, then you should treat the patient as having COVID-19, even if your RT-PCR test is negative.
Thank you, sir. So the next question is from the parent of Ridhima Sharaf of 6E. Staying indoors for long has led to low vitamin D levels. Is supplement intervention required to get this right?
Yes, I think you should take supplement of vitamin D for two or three reasons. One is that you're right. A lot of people have been staying indoor, and therefore your vitamin D that you get from exposure to sunlight is going to be less. Secondly, there is a lot of data which suggests that we, as it is, have low vitamin D levels. And thirdly, there is some data which suggests that taking vitamin D supplements and keeping your vitamin D level at a good level also gives you some degree of immunity, which may help you or protect you to some extent as far as COVID-19 is concerned. Therefore, I would say that you should take vitamin D supplements if you're indoor, and it may not be a bad idea during this time to take it on a regular basis.
Thank you, sir, for your comprehensive advice.
And with that, we come to an end of this interactive session. I'm sure that all of us have been enlightened by this session. May I now invite our headmistress, Mrs. Rashmi Malhotra, to deliver the vote of thanks.
A very good evening to our guest for the day, Dr. Randeep Guleria, our principal, Ms. Padma Srinivasan, vice principal, dear students, parents, and colleagues. I would like to thank Dr. Guleria for not just the session today, but also for the selfless service being rendered to the society and the constant guidance being provided by Sir through the news and the social media. Sir, in this time of huge crisis at the world and the national level, we look towards God with prayers, and we look towards eminent and learned medical personalities like yourself to show us the way forward. I can't thank you enough for patiently answering queries of one and all and always imbibing hope. On behalf of the students, parents, and the faculty at DPS Arkipuram, I once again thank you for this extremely informative session today. I would like to thank our principal for providing this platform and the team which works relentlessly behind the scenes in making these sessions possible. Thank you.
Thank you.
Thank you, ma'am. And we would also like to extend our gratitude towards everyone present here for devoting their precious time for this program. Thank you.
Thank you.
Good, sir.